you have to ratify the every facts, because there is at least one either 10 number or short note comes from here, and in every MCQ exam that you will face later, either it is FMG, not FMG, you will not face, sorry, UPSC or INI-CET or your NEET-PG, there will be at least one MCQ from this every year. Okay, that's why this topic is that much important. So before going into the topic, I will ask, there is some pre-assessment questions, what you actually know. See the question from last bench. Sir, answer, anyone? যদি পড়তে না পারছো সামনে এসো. So what is the question actually?
What is a hazard?
What are the options?
Anything with the potential to cause harm. Yeah. Number A.
That is your answer. Okay. Anyone disagreeing with his answer? He is answering A. Anyone? Okay, sir.
Sir, all of the above.
All of the above is not an option.
No,
সবকটাই মনে হচ্ছে
সামনে
সবকটাই মনে হচ্ছে
সবকটাই মনে হচ্ছে, no, but previous answer was right, that is option A. Option A is the correct answer. It is also from your disaster and hazard chapter, na? Second, who has the responsibility for health and safety at your place of work? The client and the main contractor, self-employed contractor, employer, employee and subcontractor. And last option, everyone at your place of work, no matter who employs them. C, D, A, B, whatever. What is the answer? C. Why not D? Everyone involves patient also. Okay. In your place of work, think about a hospital. Is the onus to the patient? No, na? Question 3, you will answer yourselves. So, accidents are best prevented by the health and the safety. This accident is accident related to healthcare facility. Suppose a needle stick injury. So, accidents are best prevented by whom? C. Okay. So, your mindset is in the right position. Huh? C. Very good. We know PPE actually was not very important when I did my internships. PPE was there, but when COVID actually hit, the PPE MCQs and the use of PPE became famous. What is the best way of dealing with a hazard to ensure others are not put at risk? What is the best way? Who are with A, who are with C? Or any other answer do you have? Why C, sir? Sorry, you said C. Why C? D. Okay, sorry. Why D? Is this the best way? At least not B. That you are sure, na? So answer is, actually, he is correct. D. We have to first identify, and if we can identify, then we can give warning sign around them. So there will be no attachment or contact with the normal population. Here comes you all see the C sign or radioactive symbolism. The symbolism comes from there. That first we have to identify and warn public about it. Okay. The legal responsibilities of an employer with regards to health and safety include what? Now it's actually coming to the management part, that is not in your purview, but what can I do? The MCQ actually came. This should not take that much time. What is the answer? Correct. So coming to the biomedical waste. The definition came from the Biomedical Waste Management Act, employed by our Indian legal system. That biomedical waste means any waste which is generated during the diagnosis, treatment or immunization of human beings or animals or research activities pertaining thereto or in the production of testing of biological or in health camps. The last word health camp, when it included, then the biomedical waste management has to be included. Now the health camps, the vaccination camps or blood donation camps, that happens. Okay. Previously it was only for the healthcare facility, whether it is tertiary or primary. But when the word in health camp included, there are too many blood camps actually now organized throughout the year. In your locality there will be at least 2 blood camps. During festivals it's a very easy way to get tax concessions also. Okay. But they previously do not maintain the BMW managements. Okay. The discarded blood soaked cotton, band-aids, they were just throw it away. But when the health camp word is included in the law, that BMW, then they also became a part of the BMW management. Okay. And if we classify the HCW or healthcare waste, there will be some general waste and which are non-hazardous mostly. It contains some papers, food items, which we use in our day-to-day use. This does not include they do not belong to BMW, that is biomedical waste. A question came once in AFMC that a banana peel discarded by a HIV infected patient, where it should be put? General waste. The HIV affected patient was given to give a spin, but does HIV spread through a peeling banana? No. So you have to have that concept, and then obviously banana peel goes to the general waste. Also batteries. This comes to the battery we use it now in everyday waste, everyday use. In hospital we use battery in BP machines if it is not manual, and also every hospital has some wall clock like that. The wall clock also use battery. What is that? General waste. But if we say that battery came from a pacemaker, is that general waste or biomedical waste? I specifically said the battery. So it is a general waste, but what we do with it? We send the pacemaker battery for reuse to the manufacturer. We do not discard it. Okay. The pacemaker battery is also came as a question in your MCQ. So as we see, majority of the healthcare waste is general waste, almost 85%, and very small quantity of waste is hazardous healthcare waste. Okay. For whom it is applicable to all persons who generate, collect, receive, store, transport, treat, dispose or handle biomedical waste. So to all persons who generate. So patients do not generate BMW. If we treat them, BMW generates by that. That's why in the previous MCQ everyone was not the answer. Okay. Those who are collecting, that means our janitors working in the wards, receive. After segregation, there will be transport of the biomedical waste, and those who are received, there is now a CBWTP. Okay, WTP is stands for waste treatment plants. Those workers, though they actually receive biomedical waste from the hospitals, they are also liable to maintain the Biomedical Waste Act. And in their treatment facility, there are workers, those who are treating the waste, and after treating, the remains are usually going for landfill or any other things. They are also responsible to maintain the Biomedical Waste Act. Okay. Now coming to the 4 being coded, or the maximum questions comes from this. Okay. I have actually put a YouTube video, so I don't know whether it will play or not. That is the biggest concern. কিছু আওয়াজ আসছে স্পিকারগুলো? See this video carefully, okay? There are too many words if I describe this. What are the hazards? This also one thing. If we go by, if we discard it as normal, it can pollute the air. Now it is polluting the water. From upstream, it is going to the downstream, and wherever it go, it will pollute. Okay. If we use that water, we are using polluted water. These are drinking. These are the hazard is actually goes by like that. And what are the hazards of healthcare waste? It comes as a short note.
These are some of the diseases that can be transmitted if biomedical waste is not disposed of properly.
HIV, Hep B, Hep C, and antibiotic resistance. These are the 4 points you have to write. What?
Segregation. Segregation is to be done at source. There are 4 color-coded containers for biomedical waste: yellow, red, white, and blue.
The flashlight হচ্ছে না?
For human anatomical waste, these include human tissues, organs, body parts, and fetuses. Soil waste contaminated with blood and body fluids are also discarded in the area. Expired and discarded medicines like antibiotic, cytotoxic drugs, including glass, plastic ampules, and vials, all go in the yellow bin. Clinical laboratory waste, such as blood bags, lab cultures, specimens of microorganisms, live vaccines, human and animal cell cultures, tissues, and devices used for cultures also go into the yellow bin. The red bin is used for contaminated recyclable waste. These include waste generated from disposable items such as tubing, bottles, intravenous tubes and sets, catheters, urine bags, syringes without labels, vacuutainers with their needles cut, and gloves. The white container is used for metallic waste sharps, sharp items that make no sponges of glass, such as needles, syringes with fixed needles, needles with needle tip cutters, scalpels, and blades. The blue container is used for glass waste. In the blue bin, you can throw broken glass, contaminated glass, and metallic implants. All the waste is to be collected if the bin is 3/4 full. Personal protective equipment.
See this part. It has came as INI-CET MCQ. What is the order of donning the PPE? Okay.
The boots are to be worn. Ensure that they fit properly. Next, put on the gown. One must make sure that all outer garments are covered properly and the strip secured tightly. Then the mask is to be worn. Make sure that it is fitted correctly. Once this is done, wear the goggles provided or a face shield if one is wearing spectacles. Finally,
This is the table. Now you all seen the video. Now I will ask you. We all know where will the vacuutainer will go? Huh? Vacuutainers. Vacuutainers means where we collect blood. It contains some chemicals. If it's a EDTA vial, it will contain EDTA. Before you answering, first you ask me whether it contains blood or not. If it is containing blood, where it will go? Yellow. But if it's empty, that is the correct way of thinking. Because both questions have come in AIMS exam. Okay. Where will you discard empty vacuutainers? Where will you discard blood containing vacuutainers? What will be happen to urine bag? Huh? Yes, without urine or with urine? With urine. Urine is not blood. Yes. And what about IUD? IUD contains plastic, metal, copper and some threads. For IUD there is specific one word, red. Remember it, write it down. Okay. It has been specified. Pacemaker I already told you. And now coming to yes, live vaccine. A vaccine vial containing live vaccine, suppose BCG. And if it's a empty MR vial, you will treat as a broken glass. Broken glass. A blood transfusion set. Blood transfusion set, BT set. Huh? Yes, sir? First we have to separate the needle. A BT set contains needle. The needle will go to sharp and rest of the thing is plastic. So, whatever the bin should be. Okay. This kind of questions, it is actually been asked in your NEET-PG or INI-CET now. The direct questions are over. Now they will made you think like that. Okay. In the reality, what we will do. And this video actually did not show something. Before we put the sharp needles in the white container, it actually has to be gone by hub cutter. Okay. What is that? It actually separate the needle part from the plastic part. Usually previously there was glass syringe, now we use plastic syringe. Glass syringe usually came with fixed needle. So, if the MCQ comes as a glass syringe, the whole thing is went to sharp. If it's a immovable sharp thing in the device, the thing will go to sharp waste. Okay. And if it is possible to separate the needle or the sharp scalpel from the plastic part, it will go to separate bins. Okay. That is the way it has been practiced in your hospitals. And when you become intern, you have to abide by that. Okay. And also gloves. What happens to the gloves? Red. And for gloves, we do not ask whether it is blood soaked or urine soaked or feces contaminated. Okay. Gloves, whatever in the form it is, it will go to red. Okay. For the management of biomedical waste, we actually follow some principles. It has been asked, these principles, that there must be sustainable development, the polluter pays. Okay. and there will be some precautionary principle, the duty of care and the proximity and prior informed. You do not have to know regarding all the thing, but it added in the Biomedical Waste Management Rules in 2016, and from there on it has been asked multiple times in the MCQs. Okay, usually 3 or 4 options will be given. Among of them you will be asked what is not the principle. So you have to remember these 6 principles. Okay, the another the odd option will be something regarding to the prior informed. They will add only the informed principle. The option will be like that. Okay, that is why you have to remember this by the word. I told you, it's a very boring topic. Hazards, you all saw the video, what will happen, and these are the salient features of the biomedical waste 2016. Nothing to understand here, only you have to ratify. First, the ambit of the rules expanded includes camps. I told when the health camp word is added, before that the health camps were not included and were not come under the BMW Management Act. But following 2016, the health camps, immunization camps, they all came under it. Okay, and there is one another thing, that is phase out of chlorinated plastic bags. What is the yellow container? You say what it contains. The content, we should directly do not put the thing in the container. There is a bag. We only put in the bag. What is the type of the bag? Non-chlorinated. Okay. And also microbiological waste, this thing, report major accidents. These major accidents actually include what are the needle stick injury. Now in every hospital, in every OPD, even here also, medicine OPD, if you go by the, in front of the OT, there is a chart stating what to do if there is a needle stick injury. Okay, there are multiple things you have to know during your internship, what to do if there is a accidental exposure from patient to you. Okay, or even the vice versa. You try to break the ampule and use. What is the life cycle in BMW? It came as a 10 marks question I saw in one paper. That's why I put the thing that this is the generation in healthcare facility. There is generation of BMW waste. Okay, here we divide into those things. First is liquid waste management, and we send it for reuse. What are the liquid waste? Suppose there is a mercury broken thermometer, broken aneroid sphygmomanometer, those who contain mercury. Okay, there is mercury spill. What we will do with that? We will collect it in a cardboard. Do not touch it directly, obviously. You collect it in a, try to collect it from the floor in a cardboard and send to the manufacturer, because mercury is a precious metal and it cannot be discarded openly into the nature. Okay, and what are the other waste? It has to be segregated. What is the segregation? That put it in the correct bin. From there will be collection. Then the in-house transportation means we'll send it, transport it to the waste treatment plants. Okay, for their temporary or we can do temporary storage area in the healthcare facility also. We can transport it to there. The final destination is waste treatment plant, but waste treatment plant workers will not come regularly or daily. They will come once in a month. Okay, so what to do there? By then we have to create a temporary storage facility in our area, in our campus. Okay, for there we have to temporary storage and then off-site transportation to CBWTF, their unloading and treatment, and the what is the final verdict? Which is reusable, they will go for recycling, and those which are not reusable, they will go for landfill. So now coming to the question, which is recyclable and which is not. Now there is one another color, that is green. Green is for general waste. What I said before, the general waste, the banana peel, papers of your work. What is the fate of them? If it is general waste, it will go by incineration in the incinerator. I will show you the picture later. And what is their fate? Secured land filling. Okay, লেখা কাগজে আর দ্বিতীয়বার লেখা যায় না. What will happen to the red bin that contains infected plastic, syringes, gloves and plastic waste? They will either go by autoclaving and secured land filling. And if it is unused, it will go for recycling. What for the infected waste? That is yellow bin. It either goes by autoclaving or plasma pyrolysis or incineration. Then if it is not reusable, then goes by deep burial. If I ask what will happen to the linens or gowns we wore in OT, in which bin it will go? Blood soaked or not, in which bin your linens or gowns will go? Gown or linen, it will go to the yellow, okay, and we will put it in the autoclave. After autoclaving it, we will either made it reuse, or if it is not usable anymore, if after every cycle of autoclaving it will shed some their threads, okay. So after a few times of autoclaving it is not usable, then we will go by deep burial only, otherwise not. What will happen to the glassware, that is blue bin? Antibiotic vials, metallic implants, glasswares, they will go to recycling after gone through autoclaving. Orthotic implants, okay, ortho implants, that you all know about ortho implants. Where they will be put? In the blue bin, and they are going for recycling. They never got wasted. Those are metals made from titanium. So it's a very valuable metal. It has high price in the market. So we will not waste them. We will reuse them. What will happen to the cochlear implant? Cochlear implant also is like pacemaker. So but it also has battery. The battery will set to reuse, because it might have some life in self life in them, or we can use the chemical to make another cochlear implant. What will happen to the sharp needles? It will go to sharp pit. Easy as that. Now what are the processes we do to minimize the threat? These are the 4 rules of waste minimization. The health facility should follow, even waste treatment facility. These 4 R's also has been asked, that is reduce, reuse, recycle and recover. Only remember the 4 words, nothing else, and this is actually not for you, okay. These 4 R's are very much important. It has been asked multiple times in your INI-CET exams, okay. What are the 4 R's? And there will be some another R's. Recover and recycle is there. They will add another word. It's used from R. Coming to the disinfection, it actually comes in your first chapter, disinfection of any area. If there is a blood spill in your floor, what you will do? If there is any blood spill, just remember it has been asked and it came as a again. Actually it is important in your final year. It has been asked multiple times in surgery papers. If there is a blood spill, first we use some adsorbent. Then we will clean the floor with 1% sodium hypochlorite solution, nothing else. After that we can use phenyl or anything. Usually the adsorbent we use contain some phenolic compound. They do the work, maximum work, and they actually disinfect the area. After that we use sodium hypochlorite to make 100% disinfection, and then we use the water. Okay. Now coming to the disinfections things, these pictures has been asked previously. I don't know they make the trend again. It has not come in some years, 3 to 4 years, but again it come in your MCQs. What is this? This is autoclave. If you want, you can read it when I will give you the PPT. Otherwise, its principle or use is not important. Just recognize the picture. This is autoclave. This is microwave, okay? Not our kitchen microwave. This is hospital microwave. This is sodium hypochlorite solution. What are the use? And this is the transport system for any healthcare facility. How we transport? From small bin we collect into the larger bin of the same color. That means what is the blue containing the blue from all ward will go to a larger blue color bin, and from there it will go to the temporary storing facility, and all of them should carry the correct symbolism. What is this symbolism? This is biohazard symbol. And what is this? Hazardous, containing hazardous and cytotoxic drugs. Both these symbol has been asked in NEET-PG. I think this one came in 2017 NEET. In the temporary storage facility, there are larger bins like that where it has been stored for a month. Okay. These are the pictures of a microwave I already shown you. This is Hydroclave. Hydroclave is same as autoclave, okay? But do remember this picture because it has been asked, okay? Again, another picture of hospital grade autoclave. The previous picture was only department where we use the only small scale. This is a large scale hospital grade autoclave machine. This is a circulating hot air oven. Actually these things, hot air ovens used in your microbiology department for disinfection of glass vials, test tubes, everything. If a petri dish containing bacteria, suppose MTB or anything else bacteria, where it will be discarded? This is a large scale incinerator. This is encapsulation. This encapsulation, I suggest you to read this principle and how it is done and what are the advantages and disadvantages, because it came as a short note. Okay, encapsulation. Deep burial, nothing to see there, but what is the minimum length of the deep burial? What is classified as a landfill or what is classified as a deep burial? The depth, how much meter you have to read, okay? It varies from facility to facility. This is a mechanical treatment plant, this is biological, and this is sanitary landfill. Sanitary landfill is not like dhapa, jara Kolkataয় থাকো ধাপার মাঠ দেখেইছো. It is not like that. That is totally unsanitary. For sanitary landfill, you have to maintain some criteria. Please read from these PowerPoints. Okay. So coming to your post assessment. First, a diaper contaminated with cytotoxic is considered biomedical waste. True or false? True. Bhabar kichu nahi. How many colored bins do I need to maintain? 5. What are the colors? Sharps are collected in white, সবাই জানে. White beans or plastic cover or solid container. or white box. বিনস তো অনেক কিছুর হতে পারে। বিন তো হচ্ছে সবচেয়ে ভেগ অপশন, বাকি বি সি তে ভাব। We will go by solid container or we will go by plastic box. White বক্স, কার্ডবোর্ড বক্সে শার্প রাখবো, রিস্কি হয়ে যাচ্ছে না স্যার? সলিড কন্টেনার, প্লাস্টিক কভারস means plastic bag only. We cannot put it now. Biscuit wrapper is disposed in which of the following is general healthcare waste? B, যারা ইয়ে করেছো বি। Which of the following is not a step in waste management healthcare facility? Training. Autoclave of non-sharp waste will go to autoclave of non-sharp waste, landfill. Incineration of non-sharp waste, ash pit. These things. Soiled gloves, gauze and bandages are infectious, true. বলার কিছু নেই। Okay, over.